We're here today. It's October 23rd. We're about 30 days out from Roxanne's uh, MBLEx. And today we're going to cover healthcare terminology. That's something that Roxanne has said, prefixes, root words, suffixes. Let's walk through it. So that's what we're doing today. This is considered medical terminology or healthcare terminology. Here are some examples of root words. So even though we're going to go to pre next, and then we'll do some suffixes. But I think you know a lot of these.
Yeah.
All right, let's take a look. What's this one?
Gastro, the stomach.
Have you heard of the gastrointestinal tract?
Yes, miss.
So gastro refers to the stomach.
Mm-hmm.
Oh, I shouldn't have
That
the
right there.
answers. I should do a slide with no answers.
Yeah.
Oh, I'm going to fix that. All right. Okay. But let's just go through it since we're learning, right?
Okay.
So NAS.
Naso.
Yeah. So what's right here?
The nostril.
So you've got the sinuses, right?
Yeah. Yes.
Here underneath.
Yes.
How about the nasal passages? Have you ever heard of that?
Yes, the nasal passages.
Oh, and where are our nasal passages?
In the nose.
Yes,
Up.
they are. That's a root word, naso. It's a
Oh,
nose. It means nose. And it could be a prefix too. I just used it
okay.
like the nasal passages.
Mm-hmm.
Have you ever been to the optometrist?
The eye doctor.
Oh,
Yeah.
so you have?
Yes.
Okay.
Go and
So
get my eye
optical.
tested.
Hmm?
When I go and get my eye tested.
Yes,
Mm-hmm.
exactly. Yes.
Okay.
So that's the optometrist
Okay.
or the ophthalmologist.
Mm-hmm.
Both are related to the eyes. The the there's an optical nerve. It's nerves related to the eyes.
Okay.
Optical. Yeah.
Okay. Okay.
Have you ever known anyone to get pneumonia?
Yes.
Hmm. Where does
I
that
heard
affect
about
them?
it. The lungs.
Right?
Yes.
So it affects the inflammation of the lungs. Now, you and I have talked also about CPR.
Yes.
And what is the P in CPR stand for?
Pulmonary.
Another word that represents
Okay.
lungs,
Okay.
right?
Yes. Yes.
Yeah, good. All right. There's a study of massage called myofascial release.
Okay.
And so
The
using
muscle.
the principles of what we've just talked about, if we split
Mm-hmm.
myo, like here's how you spell it. I'm going to
Yes.
put it in the chat. Do you see the chat?
Yes, miss.
And the chat uses the first word. If we made it it's three syllables. Did you ever do this in elementary school or school where you clapped to the syllables?
Oh, don't remember.
Okay, so if we clapped to these syllables,
Yeah.
I'm pulling out going back to my old days. Um,
Okay.
but the word myofascial has three syllables.
Okay.
Oh, it has four. Yeah, it does. Myofascial.
Okay.
How would you say it?
Myofascial.
Myofascial. Good. Okay, still four syllables.
Okay.
So myo is the first part of the word.
Mm-hmm.
Fascial is the second part of the word.
Okay.
The second part of the word, what do you think that has to do with in the body?
Uh, so the fascia is the you explain it, the clear thing underneath the skin where you
Exactly.
get the gliding of the skin. Yes.
Exactly. It has to do with, so, and when we look at this part of the word, this is a prefix.
Oh.
Myo has to do with
Mm-hmm.
muscle. Myofascial has
Yes.
to do with muscles and fascia.
Fascia. Okay.
So that's a study of how to release the muscles and the fascia.
Okay.
Myofascial.
Fascia.
Okay, next one's easy. What
Mm-hmm.
does it say?
Cardio.
Mm-hmm.
Talking about the heart.
Yes, yes. Can you give me can you use the word cardio in a sentence?
Uh, Let me see.
You can make it a part of a bigger word, or
You have cardiovascular. Mhm.
how would you
All
use
right.
the
So,
word cardiovascular in a sentence?
um, I think like cardiovascular is when you hold on. I want to put it properly.
You just take your time. You take your time and think about it. Using cardiovascular in a sentence.
Okay, cardiovascular. I don't remember like what vascular mean, but I know about cardiovascular. I know the name.
Yeah. So what have you used, when have you heard it before?
Cardiovascular. Like when you, like for instance, when people cardiovascular, when they're talking about like heart attack or
A heart attack.
yes.
Uh-huh. Keep talking. There's a sentence in there. Come on.
So like if someone getting an heart attack, so you have the specialist that just work like in that field, cardiovascular. They study that just the heart only.
Very good. That's right. Yes.
Yeah.
And so also you said, wait a minute, I don't remember what vascular means.
Hmm.
It's a fancy word for blood vessels.
Okay.
The cardiovascular system is the whole highway of all
Okay.
the
So the
veins and
purpose.
the arteries and the capillaries and the heart. And yeah.
Okay.
Also, you've used this word to talk to me about CPR.
The
What
pulmonary
is the C in CPR?
cardio.
Yes, it is.
Yes.
Yes, it is. So you've been using healthcare terminology
Yes.
already. When you talk
Okay.
about CPR, what does it stand for again?
Cardiopulmonary resuscitation.
Yes, it does.
Okay.
You said that so clearly
Yes.
and with confidence.
Right.
And so now, really, you know that cardio, heart,
Yes. Mm-hmm.
pulmonary, lungs,
Mm-hmm.
resuscitation. Let's
Yes.
resuscitate them. Let's get them back, right?
Yes. Yes.
Yeah. So when we do CPR, we're working on the heart but we're also, CPR involves the compressions
Yes.
and the rescue breath.
Yes. Yes.
We were at cardio. What does this say?
Art RTO.
Mhm.
Hmm.
Have you heard of a pathology called arthritis?
Yes.
You have. We
Yes,
happen to
I've
have
heard
studied
of
it last week,
that. Yes.
right? Rheumatoid
Yes.
and osteoarthritis,
Mm-hmm.
right? They're different, aren't they?
Yes. Yes.
Tell me, Roxanne, how are they different?
So the arthritis, osteoarthritis, we most likely feel them in the joint. Mm-hmm. So that's where you feel the inflammation, like where the vein, not the vein, the joint, they rub together and cause the inflammation. So that's the osteoarthritis, and the rheumatoid arthritis. You can feel it all over in your body.
I'm so
Yeah,
happy right now.
I'm learning.
Dude, like when
Yeah.
you have a client and she
Hmm.
comes in and says, I've got arthritis,
Yes.
you're like, what kind?
Yes.
We're going to assume osteoarthritis,
Yes.
pain in the joint. Oh, I actually had a client earlier today, and she's like, oh, I've got a little arthritis in my hip.
Hmm.
I know she's talking about osteo,
Yes.
right? Because she's talking about a
Because it's in
joint.
the, yes, in the
Yeah.
joint.
And so look at this, arthritis,
Yes.
artho.
Yeah.
Artho means joint.
Yes.
Okay.
Mm-hmm.
Osteo means
Means
bones.
bone. Hmm.
So when we have osteoarthritis,
Yes.
it's arthritis in our joints that affect the bones, the
Okay.
distal and the proximal ends of the bones.
Mm-hmm.
Is that making sense?
Yes, miss.
Okay.
Yeah.
All right. All right.
Okay.
And the next one.
So we have gluco and glyco. That's how you pronounce it? I'm not sure.
Yes. Yes, exactly how you pronounce it. And
Okay.
so you'll hear about different types of sugar in the body.
Okay.
So sugar takes on many forms when we eat it, right?
Yes.
We got white sugar, we got brown sugar,
Mm-hmm.
we got all sorts of sugar,
Mm-hmm.
like fake sugar.
Yes.
When we eat fruit or any type of natural sugar, even white cane sugar,
Yes.
it enters our body and is digested by our belly, and
Mm-hmm.
that sugar turns into glucose in the bloodstream. Athletes will use sugar to
Mm-hmm.
help bring their energy up.
Okay.
Kids, right? When
Yes.
kids have too much sugar, what
Yes.
happens?
They be playing all over, running up on
Crazy.
running all over. Yes.
Yeah,
They don't sleep.
because there's that much sugar and sugar translates to energy.
Yes, that's true.
Boom. Ah, right?
Mhm.
But sugar has a peak and then a drop off.
Okay.
Yeah. Yeah. And so that's why we regulate sugar in our diet, regulate sugar for kids
Yes.
so they don't run, 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 and then crash,
Yes.
right?
Okay.
And that's why
Yes.
we regulate sugar even in athletes because we don't want them to get halfway through the race and then
Yes.
crash.
Okay.
So typically an athlete who, and I say this from a massage point of view,
Yes.
when an athlete is training over the period of 60 minutes, like an hour or longer, they usually need to find something to eat.
Okay.
Oftentimes after a race, say like a 5K
Mm-hmm.
or a triathlon. Have you ever been at the finish of a race?
Oh no.
No? The funny thing is they hand out bananas.
Oh.
They have like cases of bananas.
Mm-hmm.
Bananas are a natural source of sugar
Yes.
to help them recover. Bananas
Mm-hmm.
also have potassium,
Okay.
which also helps an athlete recover.
Okay. Mm-hmm.
But I bring that back to glucose or glycogen. If you see that word on the MBLEx,
Yes.
it's talking about blood sugar levels.
Okay.
It's referring to sugar in the blood. So sugar that's been digested
Mm-hmm.
and is now in the bloodstream.
Okay.
Okay, we're gonna go over some prefixes in a minute and we'll come back to sugar.
Okay.
Last one.
Neuro.
Mm-hmm. Look what it has to do with.
Mm-hmm. The brain.
Right. A,
Yeah.
a neurosurgeon, brain surgeon, right?
Yes.
But also a neuroscientist studies the brain and the nervous system.
Oh.
Okay. So
Yes.
it's the brain, the spinal cord, and the nervous systems. The neuroscientists, neurosurgeons, neurodoctors
Mm-hmm.
normally are dealing with pain that's coming
Mm-hmm.
from the brain. Something's
Okay.
happening here. Now, some
Yes.
neuroscientists specialize in the spine,
Yes.
but neuro technically means the nervous system.
Okay.
We think of the brain, but just
Yes.
remember, you might be getting a question that has to do with all the nerves.
Okay.
Okay.
Yes. Yes. Mm-hmm.
That's why we're doing this.
Okay.
All right. You ready for the next one?
Yes.
It's a lot.
Yeah.
All right.